Let's review osteokinematics, which are bone segments moving relative to each other. This osteokinematics describes larger movements, so the flexion extension, ABA deduction, internal external rotation, plantar flexion, dorsiflexion, pronation, supination, all kinds of things that happen in movement, human movement. So we're going to go through each joint and look at all the motions, the osteokinematic motions that can occur at these joints. So hip joint, it's a ball and socket joint. So it articulates between the pelvis and the femur, and we can flex and extend in the sagittal plane. We can AB and adduct in the frontal plane, and internally and externally or medially and laterally rotate in the transverse plane. If a joint is able to flex and extend and AB and adduct, it can also circumduct. And circumduction, if you think back to your phys ed days when you did arm circles, that is circumduction. At the knee, which is a hinge joint, and the articulation is between the femur and the tibia. So an odd, a curved surface on a flat surface. We can flex and extend in the sagittal plane. There is slight internal and external rotation, but only when the knee joint is in flexion. The ankle joint. It's an articulation between the tibia, the talus, and the calcaneus. And we have plantar flexion and dorsiflexion. So plantar flexion is when your toes are up. Plantar flexion is when you kind of go on your tiptoes. You can also have inversion and eversion. Some people technically say that's the subtalar joint, which is a off-axis joint below the ankle joint, and we'll talk about that more in detail. And that is where pronation and supination of the subtalar joint come, and that's a complex motion that will be discussed later. At your toes, the metatarsal phalangeal or the MTP joints, which is between the metatarsals and the proximal phalanges, you can flex and extend. You can also AB and adduct. And remember, the midline, you always need a midline for reference for abduction away from the midline and adduction toward the midline. The midline of your foot is your second toe. Then we have our interphalangeal joints, or between the phalanges, and those can only flex and extend in the sagittal plane. Shoulder or the pectoral girdle, there's a few joints in this region. We're going to talk about the articulation between the scapula and the thorax, which is a weird articulation. The translations are elevation and depression, so you can shrug your shoulders. There's also AB and adduction. And then there is a rotation. You can have upward rotation, which is looking, your glenoid fossa is pointing up. So if you raise your arms above your head, downward rotation occurs when you're bringing your arms back down in adduction. You have protraction and retraction. Some identify protraction as a abduction of your scapula, so they're moving away from the midline, and retraction is a deduction, or it's moving toward the midline. You can also have anterior tip or tilt and posterior tip or tilt. And here is showing these movements: elevation, depression, adduction or retraction, pushing your scapula together, abduction or protraction, kind of rounding your back or your posterior upper thorax, upward rotation, arms going into abduction, and downward rotation, your arms going into adduction. The shoulder or the glenohumeral joint, or the GH joint for short, it's an articulation between the scapula and the humerus, and you can flex and extend in the sagittal plane, AB and adduct in the frontal plane, and you can have internal rotation, external rotation, or medial lateral rotation in the horizontal plane. We also, since our scapula are not connected by a bone, if you raise your arms to 90 degrees of abduction, you can have something called horizontal abduction and horizontal adduction. And you can also circumduct. At the elbow joint, which is also a hinge joint analogous to our knee, it's an articulation between the humerus and the trochlea, or the trochlea of the humerus and the ulna, the trochlear notch. And it results in flexion and extension. There's also movement between the humerus and the radius during this movement. The forearm, or your radial ulnar joint, it's a very long joint, and the motion is pronation and supination, which is in the horizontal plane. Then you have your radiocarpal and intercarpal joints. It's between the radius and the carpals. And at the wrist joint, you can flex and extend in the sagittal plane. And you can AB and adduct in the frontal plane, but we call that radial deviation when we move to the thumb side where the radius is, and ulnar deviation when you move towards your pinky or the ulnar side. And since you can flex and extend and AB and adduct, you can also circumduct your wrist. Fingers, metacarpal phalangeal, or your MCP joints. It's between the metacarpals and the proximal phalanges, similar to the toe. You can flex and extend that joint, and you can AB and adduct. For the hand, the midline is the middle finger. Interphalangeal, or your IP joints, between the phalanges, you can flex and extend in the sagittal plane. At the vertebral column. And remember, you're taking the midline with you, so you're not moving toward the midline or away from the midline. And all these motions occur at the cervical, thoracic, and the lumbar regions. We can flex and extend. We can do lateral flexion or lateral bend. So it's lateral bend to the right in the frontal plane or lateral bend to the left in the frontal plane. And you can also do rotation, axial rotation to the right, axial rotation to the left.